India's daily COVID-19 caseload has dipped below the 200,000 mark after posting double that number in a single day last month. But the country is still recording more cases and deaths than any other place in the world. Doctors and nurses who have been battling the catastrophic surge say they're exhausted and burnt out. Neha Punia has more.
There is so much to do that I do not have time to think about whether I'm exhausted at this point of time.
On the front line of the world's largest and deadliest COVID-19 outbreak, India's doctors and nurses have been pushed past breaking point, forced to fight an overwhelming surge in cases with limited medical resources. Dr. Jain runs a makeshift COVID-19 center in Delhi. When the 100 beds quickly filled up, he describes feeling helpless and stressed at having to turn patients away at the peak of Delhi's outbreak. He's worked tirelessly, even when his own family had COVID-19, but it's the lives that he couldn't save that still haunt him.
Usually you are working for approximately 14 to 15 hours in a day, and even if you are going back, then your phone is constantly ringing. So, and even after that, you are still not able to help almost everybody. Seeing people dying in front of you was very, very stressful. But if a person is dying because of the lack of medical support, because of the lack of resources, that is where the guilt comes to you.
The relentless trauma haunts Jaya Vartak too. One of more than 90 nurses at a government hospital in Mumbai, she says the most difficult part has been playing God.
तभी बीच में हमने एडमिशन रेस्ट्रिक्शंस रखे थे कि जो हमने अंदर लिए हैं उनको ट्रीट करना हमारी रिस्पॉन्सिबिलिटी है, लेकिन बीइंग नर्स और डॉक्टर हमारे लिए बहुत डिफिकल्ट टास्क है कि हमें सिलेक्ट करना पड़ता है कि ये और ये दो एज ग्रुप में से आपको किसको प्रायोरिटी देनी है.
Nurse Jaya tells us deaths at her hospital increased 7-fold in the last 2 months alone. April and May have been the deadliest months for India, with doctors saying many deaths occurred because of delayed medical care. And during these 60 days, the Indian Medical Association claims 500 doctors also died. Experts warn, like with India's official death toll, this number too could be an underestimation. Even before the pandemic, India's healthcare facilities were stretched, inadequate and underfunded. For every 10,000 Indians, there were just 17 active healthcare workers. And even now, India spends just 1% of its $1 trillion GDP on public healthcare, among the lowest in the world. During the second wave, hospitals across the country ran out of oxygen, essential drugs, beds and protective gear. And there weren't enough doctors, so medical students and interns were deployed to COVID-19 wards.
हमने वो जो दौर देखा, वो दौर अच्छा नहीं था. वहाँ पे हमको कहीं ना कहीं डिप्रेशन महसूस हुआ था. एक 10-15 दिन का वो एक पीरियड था कि चाहते हुए भी पेशेंट को हम एडमिट नहीं कर पा रहे थे, और चाहते हुए भी पेशेंट को कहीं मतलब प्राइवेट सेटअप या म्यूनिसिपल कॉरपोरेशन सेटअप या गवर्नमेंट सेटअप में पेशेंट को आईसीयू या वार्ड का बेड नहीं मिल रहा था.
Dr. Jadav's hospital provides counseling to help frontline workers deal with this suffering and grief, but most Indian hospitals do not. Experts warn unless they get help, frontline workers will suffer from post-traumatic stress for years to come. Before the second wave, India dismantled many COVID-19 treatment centers, thinking the worst was over. The government declared that India was in the end game of the pandemic. People became lax, guards and masks were lowered. With cases falling marginally once again, Nurse Jaya makes this heartfelt appeal to Indian citizens. Don't make the same mistake again.
उनको खुद की केयर करने के लिए मास्क यूज़ करना, सैनिटाइज़र यूज़ करना, प्रॉपर टाइम पे वैक्सीनेशन लेना, मेडिसिन लेना, टेस्ट करना, ये तो बनता ही है.
Healthcare workers are also urging authorities to use this time to ramp up facilities. As fears of a third wave loom, India needs to listen to its doctors and nurses. Neha Punia, CNA, New Delhi.